Hello everyone, my name is Virginia. I am 34, almost 35 years old, and I live in Columbia, South Carolina. I have one child, he's 11, and I'm engaged to be married. I was originally supposed to be married on March 21st, 321, but I ended up getting sick with symptoms of the virus beginning on March 12th. So, of course, we were not able to get married. But we have postponed our wedding to September the 19th, so hopefully we'll have a good turnout and everyone will be able to be safe. I wanted to come on here to share my experience of what I endured while having COVID-19, also known as coronavirus. Prior to getting symptoms on March the 12th, I had been running around, was getting dress fittings, I was finalizing boards for my wedding. I was pretty busy, but I was just mainly doing errands and making sure we had the last minute checks on everything. And then I met my fiance for dance lessons, and I just had extreme body aches, and I knew I could not do dance lessons that night. So we met there, we went in briefly, told the instructor that I was not feeling well, and we left and went home. From there, I rapidly continued to decline. I went to urgent care on March the 14th, which is 2 days later, with fever, worsening symptoms, and body aches, headache. And so I initially thought it was like a kidney infection because I had recently had a urinary tract infection like a couple months ago, but turns out it wasn't. So they gave me antibiotic prescription and a shot of antibiotics. And it turns out I came back the next day with a fever of 102, and my oxygen was a good bit lower, and I had a horrible cough and extreme body aches. So they give me pain medication, hydrocodone syrup, and send me home. So I'm just in agony at home. 102 to 103 degree fevers, just pouring sweat, can't get comfortable, your whole body aches, you can barely breathe, you're coughing up so much gunk, your chest hurts so bad. It was pure hell. Honestly, it was really rough having to go through that. My fiance would have to make me get up and get into ice baths to bring my temperature down. It was a very hard time. I was beginning to get real depressed because after about a week into being really sick, I thought, why aren't I getting better? I'm just getting worse. And then we went to urgent care one last time on March 17th, and they had to start an IV that time and put ice packs on me as I had a 103 degree fever, and told me if I had worsening symptoms or do not get better, I am to go to the ER, not to come back to urgent care anymore. So my symptoms, of course, continue to worsen. I just want to sleep constantly. I have no energy whatsoever. I'm almost ready to give up. And my fiance makes me go to the ER at 4 in the morning because I had 103 fever, and he had just put me in an ice bath, and it was not time for any more Tylenol. I had maxed out on Tylenol like 2 hours prior and had 103 fever, and it only went down a half a degree in the ice bath. So I agreed to go to the ER, where I was quote unquote the first tent patient. So I pulled up, he jumps out of the car, the staff comes running over. They saw how bad of shape I was in. I could barely breathe. And they put me into this tent thing. It reminds me of the movie E.T. Like but I'm the alien. Everyone else is dressed in hazmat suits, and there's plastic everywhere, and there's a lot of stuff going on. You're being poked and prodded. You're not really given a lot of information. You're asked a lot of questions about yourself. You just feel awful. You feel like you're dying. And then being separated from my fiance was extremely hard. He could not come back with me. He had to go sit out in his car. He said that he cried, and he called the only friend he knew who'd be up at 5 a.m. And he said that they talked, and it made him feel a little bit better. But they knew right away they were admitting me. I had a CAT scan, which showed my lungs were whited out pretty much. And I had an elevated D-dimer. It was 12 point something. I was oxygen saturating 77%. I was diagnosed with acute hypoxemic respiratory failure. I was then admitted to the Corona unit, which was the 8th floor tower at this hospital. And I'd had a Corona test 2 days or a couple days prior to urgent care, but it wasn't resulted through DHEC yet. We were still waiting on that, but it never was done properly. It was just done on the outskirts of my nose, barely in the inside. So I was first diagnosed as a false negative, but I actually truly was positive, which made it even more difficult in a way. But in the hospital, I was extremely isolated. It was very, very lonely. I was in a lot of pain. I started down, a dark hole. I'd say the doctors actually released me early because they felt like my mental health needed it, that I would do better at home since I had my fiance and my son to support me, because I was starting to get really depressed in the hospital being all alone. My recovery from then until now has been taking a very long time. It has actually taken me about 3 to 4 months to recover, and I'm still not recovered. I have to go through therapy. I have PTSD and pretty significant anxiety from all that I've been through. There are certain things that trigger me, like seeing my wedding invitations. Just those redone, saying, let's try this again, just triggered me into a panic episode. It's just really, really weird, especially people who don't wear masks that come near me. I am very afraid of them. It's almost like they're pointing a gun at my head. I can't explain the level of fear that I have for people who don't wear masks around me or they approach me. I am petrified of you. Please, I beg everyone to wear masks to protect everyone. I think our government's response has been horrible. The governor of South Carolina, United States of America, wouldn't even issue a mask mandate. I begged to go through the county council here, and someone started a petition, and within only a few days, we had a mask ordinance in all retail businesses and food establishments. Anywhere where people deal with other people publicly, masks have to be worn. So how is it any different in, you as a business owner have to uphold that. We kick people out of the store where I work at. I manage a small retail store in Lexington, and we kick people out for not wearing a mask. We stop them at the door. I just feel like the lack of guidance. We have state-hired South Carolina epidemiologist who specializes in infectious disease, Dr. Linda Bell, and she's urging us to wear masks, and we won't listen to her. Then why are we paying her? Why does she have a job? How about let's listen to these people who know what they're talking about? I just hope and pray that things will get better and that people will take their own personal responsibility to stop the spread of the virus. It all boils down to each and every one of us. And I'm thankful to God to have survived, and to all the doctors and nurses, my fiance and my son, my best friend Rocky, and all the friends who reached out to me and rekindled our relationships. Thank you so much.